I do, and I just want to say that I love the word thriving, and that piece, it just so much better than social determinants of health. It's so much more. So I'm excited about the next trainings. But now we have Wendy with our telehealth. So Wendy, go ahead. Thank you.
Great, thank you. I just wanted to bring back, if you just a little quick historical on this for those of you who may not have been with us when COVID hit. We decided to look into some telehealth. What can we as an ACH do to support telehealth? And after much board discussion, we decided to put an RFP to really look at telehealth community within our clinical partners, as well, excuse me, as well as what can we do in the community. That RFP went out and we gave it to 2 different organizations. WSU has taken over the community part, and Ingenium did the clinical maturity. We had hoped to have this wrapped up by the fall last year, but as we all know, that COVID has impaired a lot of work that we wanted to do, just because clinical partners just didn't have the capacity. And instead of just shutting it down and holding true to our timelines, we expanded it out to give our partners the true opportunity to participate. And so we've come to this point today where we feel like we have enough information that we can bring back to you as a board, and for you to start to ponder, and we can start to think about next steps. So Christian and Kathy from Ingenium will give you a broad overview of the agencies that they've met with, the process that they have gone through, as well as recommendations that they have for this board moving forward. We're not asking for any approvals today, so we're not asking for any board decisions, but we will be giving you a lot of meat to chew on, and we really would like your feedback to help us shape how we move this forward. And just a reminder, this is for the clinical partners only. Next month, we'll be talking about the community assessments with WSU. So this is the clinical partners only. And with that, I'm going to turn it over to Christian and Kathy, and they can introduce themselves.
Sounds good. Making sure my video and audio is unmuted. Good afternoon, everybody. Nice to meet with all of you. We've spent a lot of time in your area virtually. Both Kathy and I are here on the East Coast, and so and it's great to have reached this milestone here. As Wendy said, we were very optimistic and moving forward with the assessments, and then Delta hit, and response times from the clinics that we worked with getting slower and slower, and so but we stayed the course, and here we are today with I think a really insightful report that was very helpful to summarize. My name is Christian Malaster. I'm the CEO and founder of Ingenium Digital Health Advisors. Hail originally from Germany, if you're picking up an accent, born, raised, and educated there, trained as an engineer. Got introduced to healthcare at the Mayo Clinic in Rochester, Minnesota, lived in rural Minnesota for quite a number of years, and now reside on the East Coast outside of Maryland. And with that, I'd also like to introduce here Kathy Latender, who's been with me on this process the whole time as well.
Great, thanks. I'm Kathy Latender, and I'm here in snowy Vermont. I've spent most of my career as a healthcare administrator in different healthcare organizations. My specialty is organizational excellence, really helping organizations, healthcare delivery organizations, set a vision and achieve and implement that vision. In the context of this project, my role has been as the client excellence manager, working with each of the member organizations to ensure a really great assessment process and great findings. And so I've been involved at each and every step in the process. And Christian will be largely sharing with you our findings, but we are both available for Q&A as we get to that part.
Sounds very good. Thank you very much, Kathy. And with that, I'm sharing my screen here. Also, if I saw Rosalinda on camera earlier, Rosalinda and Jesus, if you're available, and we asked if you could maybe say a few words here. That would be very helpful. Jesus, you were the first to unmute here, so thank you very much. Jesus and his organizations were together with Rosalinda one of the first sets of organizations that went through the telehealth assessment. And Jesus, if you could just share a few words on your experience and kind of what you gained from it.
Well, thank you, Christian. You know, this was an opportunity for us to become a little bit more involved and share a lot of information about our organization with an external party that had the potential to help us assess and our opportunities for improving the use of technology in the delivery of healthcare. I would say that it's not easy, or it's not common to for health systems to share as much information as it was being requested. So there is a tendency to be resistant to that ask, but we took a chance and shared quite a bit of information with this group, and it resulted in engaging a lot of our staff from different departments, including clinicians, in order to provide really a good degree of information with depth into the organization, so that they could really generate a solution or recommendations that really had the opportunity to really have an impact. So I was pretty impressed at the result when they came back, and after they took all the information we provided them and worked through it and processed it, and they came back with a lot of good insight that we definitely are using as we move forward with improving the use of virtual care, hybrid care. So for us, it was a very positive experience, and I feel like apologizing for Christian because I was so hesitant to provide you a lot of information that you were asking in the beginning.
It's all good. Wendy teed us up here perfectly by protecting confidentiality, and I think we demonstrated that we're definitely capable. We understand there are competitive environments, especially in your situation, and yes, we're respectful of that, and we want to help everybody to get good access to information. Seems like Rosalinda is teed up in some in another commitment, so maybe she'll have a chance later. So with that, want to go into the agenda here. Also want to be respectful of our time here. This slide deck here has been sent out to you. Oh, actually, there's Rosalinda. Rosalinda, would you still be available to say a few words about your experience in doing the assessment?
Oh, sorry, I had to step away really quick.
Not a problem.
We're just really thankful for the opportunity to do this assessment with such a talented team. We really felt like they made it so easy, something that we don't know much about. They've really helped us to define a lot of things, to talk through things in our organization. We're already kind of doing so much, and how do you get to the next level? Ingenium's this has really been a great process for us, and we're really looking forward to our action plan that we just built and are getting going and things like that. So we're excited for everything we can be doing here for telehealth for our community. Thank you, Christian, you and your team.
Great. Well, thank you, Rosalinda. I appreciate it. Thank you very much. Good. Without further ado, then here, as Wendy was saying, we're moving into the overview here. We'll talk about the organizations that we've interacted with. We then talk about the process that we've used to do an assessment with the various organizations, talk about our findings and kind of generic recommendations. As we said, our process was to hold the information in confidence. And so we just share some generic recommendations that apply to some of the organizations or multiple organizations. And then really towards here, the second half is really providing some insights into the recommendations, because that was, from what we understand, the history here is like, okay, a year and a half ago, I think you started in October 2020, is to assess, okay, what should we be doing about telehealth and telemedicine? Should we go right into solutions? Should we go do an assessment? And you went for an assessment. And so we're now coming back with very well-informed solutions and services and centralized things that can be set up in the area to support all of the NCACH organizations here. And then we can talk at the end here about next steps. I'll be monitoring the chat. If there's something that pops up in your mind, feel free to put it there. Kathy may respond if we have a quick answer asynchronously here, but definitely want to open it up for a dialogue later on as well. So we've worked with a number of organizations here, gotten be very familiar. I always jokingly said I've done a lot of flyovers on Google Earth about your area and your region, just to trying to get a feel for how long does it take from Tomac to actually get to Wenatchee. So it's quite a drive. I can definitely imagine. Having lived in rural Minnesota, where everything is 45 minutes away, even the nearest stoplight, I can relate to the experience. Although it looks more beautiful where you are than the flat Minnesota that I drove through oftentimes. So we had a good mix here on the previous slide of critical access hospitals, rural health clinics, health centers, behavioral health organizations, and we just kicked off also working with Renew here with Dell as well, who finally felt that they had the bandwidth to accommodate our request for information. As Jesus pointed out, we're looking at quite some a little bit of information so we can make educated recommendations. The team we put together here, multi-talented, multidisciplined team that we brought to the process. And then our process was largely interview and survey based. And that's what was needed and gave us really good information. We did a leadership interview, an executive team interview, really talking to the whole C-suite and the leadership teams. Did one-on-one interviews with those leaders that were interested in engaging with us further. We oftentimes also met with the clinicians. We did a clinician survey of 33 questions, which I'll share a little bit about later. We did a telehealth maturity assessment, which I'll also share in a minute, to just get a starting point as to what is the maturity of an organization when it comes to telehealth, because that informs as to what are the best next action steps that an organization can take. Then we went into the analysis internally here, discussing our findings and our insights, and then presented that back into a presentation on findings and recommendations, the structure of which you will see here in the next part of the presentation. So the final deliverables, or to look at this differently, is that on the NCACH member level here on the left side, the blue, we gave them some ideas on a telehealth vision, on alignment with our organizational strategy, talked about some strategic guidance and the telehealth maturity roadmap of services. And now today we're reporting back out kind of what are the strategic priorities of the different members, what are the support needs for growing the adoption and the maturity of the telehealth programs, and what are some suggestions here for centralized support services, and then in the next phase, like once we've narrowed it down, what is actually that ask, what is that budget that is needed to establish these kind of centralized support services. Looking then actually at the findings and recommendations, it came across a number of different areas. We assessed each organization's telehealth maturity. We gave them input on what a telehealth strategy could look like for them. We played back the insights we gained from the clinician survey. We gave them some ideas on 6+ areas on strategic guidance, including a telehealth roadmap, and then discussed on what the next steps were. I've talked about this maturity model quite a bit. And so a maturity model just helps an organizations to assess where they are, at what level of maturity, so they can decide on what it will take to get to the next level. So it's a model we've developed a while back. Starts out with organizations starting at the chaotic or emerging level, moving up to coordinated and supported, and then integrated. And the top two levels, which are really where a lot of the great value lies, then is the strategic and transformative level. We have broken this down. The assessment comes from assessing 10 different dimensions. They're around the number of services and specialties and the growth trajectory. They look at behind the scenes, what kind of level of coordination, technical and operational support, as well as launch support is available, how much is leadership involved, and to what extent do you have governance over telehealth, and then ultimately the vitality, the thriving of a telehealth program. And obviously all these dimensions here are interrelated. And so then we just did an assessment on those different seven levels from 0 to 6 and the different dimensions here. And for each organization, then build this little profile and then assess that, okay, this organization probably is at that integrated level. They've already dipped into some of the strategic and transformative hallmarks, but also have some other aspects to improve. And the next slide here then shows what that looks like across the organizations that we've assessed. As you can see, there's quite a spread from organizations that are barely out of the chaotic phase of leveraging and integrating telehealth and telemedicine, all the way to one organization that is really tapping into telehealth as a strategic tool. And if you map this out, then again, across this maturity model here, you see the clustering around the emerging and coordinated, and then moving into this area. The next 3-4 slides are very text heavy. I'll defer to you to read them and study them if you want to know a little bit more, but I just wanted to create it. And what we did for these organizations is then to explain, okay, you're at the, you already mastered the supportive level. So going with the example that I mentioned earlier. So these are the hallmarks of things that you already are doing. The next goal for you really is, or where you're at, is actually at the integrated level. So you're integrated, patients have multiple services, you use generated health data. And then the next level is really then strategic. And that's why this maturity model is so helpful, is because when you get to the strategic or the transformative levels, telehealth can really help to move your strategic objectives in an organization forward, whether it's expansion in geographic areas or addressing social determinants of health or better access, care continuity, patient-centered model home, whole person care, whatever the objectives that you are pursuing. Telehealth is one opportunity, one tool in your toolkit in order to advance your strategic objectives. And then the most mature organizations here in the US are really reinventing the relationship with their patients, the ability to deliver care at a distance, and really transforming themselves towards a very virtual organization that can serve patients in multiple different ways, not just in the in-person care environment. And so that's kind of the roadmap where a lot of organizations are moving toward. We then shared survey insights. I brought a few slides here just to see that. So we, for example, had one organizations saying, well, the biggest barriers for us are technology challenges, or lower and no reimbursement, or low patient engagement and interest. So we saw a spectrum here of different answers. The other thing that we played back to these organizations is, well, how are you faring across, on those evaluations here with your organizations on the national level? We have access to national data that was aligned with the survey that we administered here. The rural is the light blue here, the third line. And so now we were able to see in terms of the priorities, how are they doing? So for example, this organization, the clinicians felt that there was low patient engagement and interest. Well, it didn't even make it to the top 5 to top 8 data points here on the national survey. And we have some insights as to why that perception is out there of low interest. And so that's just one way how we could provide some feedback and also acknowledge, okay, these are the challenges that we have. And obviously technology challenges for my patients and low interest could be somewhat related and interlinked and intertwined. And so, but that was one approach we did. We also then asked what types of resources would be helpful. So inside of the report out here today, what help do you need in order to take telehealth to the next level? And so this organization, for example, said team-based care approach, clarity on reimbursement, clinical training on virtual physical exams. So those are some aspects. Other organizations then said, well, we need some workflow refinement or training or how to do group classes. So this was a behavioral health organization. And so there we saw the different needs out there that we then reflected in the recommendations of what centralized resources and training and expertise organizations are looking for so that they can, in their organization, take telehealth to the next level. So after the survey, then we moved into strategy. As I mentioned earlier, telehealth is a strategic tool that really can help an organization to move any objectives of your overall organizational strategy forward. We first made a case for why a strategy is important. It provides clarity, prioritizes projects, helps to allocate resources like any good, valuable strategy does. And then we provided some specific and concrete feedback around the different elements of strategy. There was a great degree of maturity with regards to organizations having actually a overall organizational strategy. A lot of organizations, it was in development or in flux. And so we just provided for some organizations some generic feedback, or for some organizations that shared with us their strategic priorities, we gave them very specific ideas on how telehealth can help them. Just listening and here again, a lot of words here in these different areas that you can review. But for example, with regards to customer service, you can add additional service line that's improved convenience regarding quality, improved care transitions, improved continuity of care, management of chronic conditions, around the culture or talent optimization, or in this time of workforce shortage, how do you attract good talent? It's by saying, well, we're embracing the future of healthcare delivery, which is hybrid, which is in-person care and telehealth. And so at our organization, we're taking this seriously. So do you want to work for us? So it's always a good interview question to position yourself in the recruitment. And then the three other common pillars here of a healthcare strategy around financial stewardship. It has an opportunity to reduce no-shows or to actually fill holes in the schedule. You have reduced costs with readmissions if you're in a hospital environment, or optimize facility space, offer new lines of business, geographic reach, and community impact. So telehealth really has an opportunity to really impact and affect a lot of the metrics and objectives that an organization cares about. It's not the solution for everything, but it's a contributor to move the needle into the right direction. And that's what we conveyed in that section of our assessment. The next 6 elements then were around strategic guidance. So we provided information and education. So we always had 2-3 slides on what does telehealth governance actually mean? What are the responsibilities? And then we had our recommendations. So what's here in the orange font, those were kind of some sample recommendations. So, for example, designated operational and technical telehealth support, what a lot of organizations are now doing or had already done. Leverage telehealth optimization expertise, consider a launch methodology. There's different aspects of support that we consider. It's not just the operational and technical support, but also launch and optimization support. And then here are some hallmarks of an optimization leader that one should be looking for in the organization or outside to bring to help with any optimization and standardization of telehealth. We then moved into telehealth performance measurements. How are you knowing that telehealth is going well? And so we looked at, we provided for all organizations a recommendation on measuring at least these 5 core metrics here of clinician and patient satisfaction or client satisfaction, the technical performance, visit volumes, and reimbursement, and then provided with some additional information around, well, how do you actually set up kind of measurement systems? And so that's the graphic here on the right side. And the 4th area then was around telehealth technology. And so a lot of organizations went with either run-of-the-mill technology like Zoom or Doxy.me. Some organizations shifted towards the EHR provided telehealth and telemedicine solutions. And so here some are looking at it, augmenting their offerings with maybe tele-exam capabilities or remote patient monitoring. So all of these elements fall into telehealth. Some organizations were looking for some input into how to market it, how to make patients more aware of that this service exists. And then we also provided a lot of organizations kind of a roadmap of improvement projects, but also some low-hanging fruit or imminent next telemedicine services that they could be launching once they were established in their maturity. For example, this is a chart here with 9 common virtual care services, starting with what we typically think about when we hear telehealth. We're thinking about video visits, but then also the telephonic care, which was very prominent during COVID, especially when video links were not working, when the video technology was frustrating. But then moving up to tele-exams, the whole RPM world, and then all the way here to digital therapeutics, being a very asynchronous, very complex, but and up and coming, especially in the mental health space. Digital mental health, digital behavioral health therapeutics are kind of the next frontier, if you will. But they're best introduced when already other telehealth and telemedicine processes are working well and are well supported. And then this slide just summarizes what some of the other organizations that we assessed, what additional guidance came up during the conversations, what we recognized, what we realized that was unique to this particular organization. And so I just listed here our titles that we've identified. So that's was kind of the report out that we did. And then we circled back with a number of these organizations, but that was during the Omicron, mostly during Omicron or at the tail end of Delta. So we've re-engaged with a few organizations offering additional guidance or assistance, and now really moving into the stage saying, okay, here's a number of centralized or shared or even individual recommendations that we have for all organizations across the NCACH region here. So we're going to be circling back here to the organizations with a survey, which I'll share here in a minute. So the telehealth optimization solutions, we kind of divided into 5 different categories, 2 of which are more of concern for WSU because they did that community assessment, but these are items that were brought up in some of the interviews, some of the conversations that we've had, and that was around some ideas around community partnerships and community infrastructure. I'm very much looking forward to the report from WSU, which synced up at the beginning here and there. And so it was interesting to see where they're taking this. The 3 areas that we focused on predominantly and will focus on today was around the kind of centralized shared resources. What I mean by that, it's a service that can serve multiple organizations. So it's not just one organization that wanted that or needed it or was interested in such a service, but it's something that can be centrally made available and then be available for each organization that is ready for it. Centralized shared services are kind of in the same vein. You see, when we see the examples, it'll become a little bit more clear, and I'm sorry. And then organization-specific support, those were individual-specific asks that organizations asked for, but there's also kind of a pattern that emerged. As I mentioned, looking forward to WSU's more informed recommendations, but didn't want to lose track of the ideas that we did come across here. So obviously the not so invisible elephant in the room, the broadband expansion in the rural areas to allow for a reliable connection here. Wi-Fi hotspots that have been used successfully, I think, during various parts of COVID, shared telehealth kiosks and vans that were discussed even, I think, as early as 2 years ago, especially the kiosk idea. Shared staffed telehealth walk-in clinics in maybe abandoned storefronts in rural areas that are open a couple afternoons a week, where an MA provides access to telehealth services. And then engaging community health organizations, obviously digital literacy and technology expansion, the whole idea about getting patients to use technology, schools, libraries as locations for a remote clinic. And another innovative idea here around building a more accurate map of reception within the rural areas by using an app where somebody could report that receptivity here, reception, or the number of bars is really low, so that can be captured with GPS data. So just some ideas that we didn't want to lose track of and to merge with WSU's recommendations. So here are a number of services that we now, where we looked at the findings and the recommendations, and as Rosalinda was saying, kind of what is the additional expertise or the additional knowledge that is needed to take this to the next level to actually implement on the action plans. So one that really came up a lot was providing some expertise and education and support for the telehealth coordinators or any named person that provides operational support and maybe also technical support to the telehealth services. And I have more detail on the following slides here. Telehealth optimization education support. So one is for the coordinator, one is around the general topic of optimization through education support or a toolkit, which is a written resource. Website manners training. A lot of the root causes for physicians being hesitant and to use telehealth and telemedicine is that they've never been trained on actually how to look into the camera and just how to effectively use the technology to conduct an exam or to conduct even just a visit and build that rapport with a client. And so just a quick 15-20 minute website manners training has shown a tremendous amount of engagement. I saw it firsthand in an FQHC on March 17th, March 20th, 2020, right at the beginning, actually not too far from where Kathy lives, working with an FQHC. And I provided website manners training, and those clinicians went on to really have a lot of good experience in delivering telehealth and telemedicine using video. Telehealth tech check setup support, another point that addresses the challenges of getting patients to use the technology. And so a quick tech check that checks connectivity, technology, digital literacy can really make it totally different between a really dismal experience that's frustrating for the clinician and the patient and having a really great experience, or deciding that maybe telehealth is not for this particular patient. It's not the right approach. It's not the right care delivery method. Telehealth technology selection support. Now that organizations are getting kind of used to telehealth and telemedicine, they're realizing that there's some shortcomings, especially around the workflows or copay collection or filling out PHQ-9s or any other things that we're so used to in an in-person environment, for which there are solutions that exist that have these aspects integrated. So looking at providing support in maybe even standardizing on some technologies, or just taking things to the next level, or getting more mileage out of those technologies that you may already have. Those are some expertise that organizations are looking for. And then the last one in this list here is school-based telehealth launch support. Number of organizations looking to offer services in schools. That also then expands into exam tools, which we'll see here in a minute. And so that's an opportunity to provide maybe some centralized launch support. I think there's some board members here that are from the education system. So rather than reinventing the wheel in every school system, let's just come up with a more standardized approach, more common approach, still individualized for each organization, each kind of competitive area. Totally understand that, but making it easier for organizations to get started with school-based telehealth, which has its nuances and its challenges as well. So set up a school-based telehealth system for an FQHC, the same FQHC, and yeah, in terms of workflow synchronization and connection and exams, those are all things that can be solved. There's some future potential shared resources that came up a little bit, but rose not to the level that we're recommending that they'll be launched or made available at this point in time. On the right side here, then on the centralized shared services. So you saw the telehealth tech check setup support. That's to set it up for each and every organization. So, but another model, another idea is an innovative idea is to actually have a centralized resource, meaning that somebody is connected to the different EHR or scheduling systems of maybe a handful of organizations. And basically, it's an outsourced service where somebody with good customer service skills, somebody with the patience to walk patients through the difficulties of clicking on a link and opening a text message and looking into the camera and getting the right lighting, right? All of that having a centralized resource here for the 4 counties, or maybe a couple of resources depending on the volume. It's another idea and another approach to do that. Pre-contracted teleinterpreters and also pre-contracted telespecialists. The more patients are getting used to primary care and behavioral health telemedicine, the more they're looking forward to, well, why can't I go over the test results of my cardiology exam over the video, right? So the ability to access care either on the regional level or even beyond the regional level, just having these predefined and easy to use. And then 2 aspects here around standardized remote exam tools and standardized remote physiological monitoring. The idea being behind these standardizations is that you as a region, as NCACH region, may have more negotiation power to negotiate better rates with these vendors. Plus, there would be a common pool of shared lessons, of lessons learned, of best practices. And so just if everybody in the area, and like remote exam tools could be used in nursing homes or in schools. And so even though if a nursing home is served by multiple of healthcare organizations in the NCACH region, the nurses may still be using just the same exam tool. And so standardization brings here some benefit into implementing this. And then 2 more items here on the organization-specific support. One being that a number of organizations have asked for funds for telehealth equipment and solutions. Obviously, those funds could be provided by NCACH, but there's also other grants and opportunities out there that could also be centrally be researched, like what is the USDA grants that are out there, or FCC grants. There's multiple grants for equipment out there that if somebody centrally for NCACH keeps an eye out on those and then looks for requests from the organizations who is interested in that, that could be facilitated, and I think would be also a very great service to offer. And then the last one is kind of customized telehealth advisor consulting. Oftentimes when organizations actually get going, we had a call with Rosalind a couple of weeks ago, right? And spontaneously there were a couple of questions that just came up as they were working through the action plan. So providing access to expertise kind of ad hoc for specific unique challenges is something else that would be valuable. So that kind of provides a landscape here. So it's a very rich and very broad and comprehensive menu of options. I just want to take a few more minutes here to just highlight a few of these services and the pattern in which we used to describe those services. But before I go there, I wanted to share, as a reference earlier, is that we're going to, now that we have built this kind of catalog of offerings, we're actually want to go out and survey those organizations that we've worked with and ask them, well, how interested are you in those services? We did it a little bit informally with Rosalinda when we had one of those slides up on the screen, and she said, "Yep, like this, like this, like this. How are you going to do that?" So that was helpful. But how interested are you, and when do you need these services? And so we're going to go back and we're going to ask these organizations. We may even go back to these organizations who currently have not engaged in an assessment because they didn't have the bandwidth, but now can be benefiting from the centralized service offerings as well. So we'll do that, administer that survey and see what results it yields so that we can really invest, that you can invest the funds into those services that are of greatest needs and greatest urgency within the community. Before I go into the detail, I wanted to just share, and it kind of was implicitly embedded in the findings and recommendations that we shared, but I just want to share a framework here, which you will see in a lot of these services, and it's around the concept that you launch and operate telemedicine services, and then you optimize them, continuous improvement, and then you grow them by adding new services, adding RPM, adding chronic care management, adding digital therapeutics. So there's over the next years, over the next decade, there's going to be more and more virtual care services that that will be integrated into the care delivery spectrum. And so building that capacity of evaluating and adopting new technology is very important. As was implicitly evident, I think, through the findings, is that telehealth covers a lot of different areas. It's about leadership and strategy. It's about rules and regulations. It's about design and support, and it's about adoption, sustainability. So we have a number of sub-bullet items, if you will, here around all the aspects that should and need be considered around launching, optimizing, and growing telemedicine and telehealth services. And so this is knowledge that a telehealth coordinator would want to get proficient in. This is knowledge that when you want to do an optimization, you would want to make sure that you have these things. And that's where kind of the telehealth maturity assessment came from as well. So here's the first service that I built with a little bit of an animation. And so we have the telehealth coordinator education support. We always started out with a problem statements based on our assessment and findings. So in this case, it was many organizations have or would like to establish the role of a telehealth coordinator and to provide operational and optimization support, yet have limited resources and or staff with limited expertise. So that was the problem statement. The desired outcome then is that we have knowledgeable telehealth coordinators that are confidently providing effective operational and optimization support to all services within their organization. So that's the desired end state. The value of this obviously would be that there's some knowledge that the coordinators will enable the organization to establish and to grow and optimize a well-performing set of telehealth services that are clinically efficacious, that are financially sustainable, and result in high quality experiences. And then we wrap this up here with the fourth box of describing a number of alternative approaches to this. It's not a kind of one size fits all. There could be a telehealth coordinator launch program, like the first 100 days, like the presidential first 100 days. There could be a telehealth coordinator mentoring or coaching or learning cohorts, right? So having multiple organizations that are interested in learning, bringing the telehealth coordinators, the technical support people together. There could be workshops and education sessions around optimization or workflow design or policy development or technology selection or whatever the challenges are. Advisory services, ad hoc advisory services, and then as well as some pre-recorded courses, maybe around website manners training, which was also an explicit element. So this is the pattern we used: problem, desired outcome, what's the value of achieving the desired outcome, and then what approaches are available. As I mentioned earlier, the slides were sent to you earlier in a PDF, and so you can review these other services here. And we also use this to send out to the organizations to define what we mean and then to gauge the interest. And so I got a message here that we've got only a few minutes left. And so with that, I'm actually gonna go through the next few slides here quickly. I can come back to any of these services if you'd like. But let me just finish my animation here, ABC, and then ABCD. And when we've got two more, so they're all defined here. And then with that, that's the overview slide. And so as we've mentioned, we're going to be looking at now sending that out as a survey. And with that, I'll actually go one animation back here, and I will open it up for any questions or other comments.
Thanks for that. This is Mike Tukey. I do have a question about
Yes.
rural health clinic status. Because we were doing some visits, you know, like annual wellness visits, but our rural health clinics, when they put in the code for that visit, Medicare would not did not count those towards our you know, some of our coding around like HCC coding. So we ran into some trouble doing telehealth for those types of visits.
Yeah.
So there's definitely some work to do on trying to make sure that, I mean, telehealth is obviously necessary and really critical to our future, but we need to make sure that the work allows us to still capture metrics.
Right, and to get the credit for it. Yes, it's
Yeah.
Yep, you're right.
Did you find that in your region as well?
Oh, definitely. We certainly find it all around the country. I mean, it is essential that you have somebody who's staying on top of the changing regulatory and reimbursement pieces. We have someone in our team that does that, but and Sam in the assessment shared some of those with some of the individual organizations as well. So definitely it is an evolving landscape and one that people need to stay on top of. And it's one of the reasons we recommend in the performance metrics looking at reimbursement on an ongoing basis, because sometimes it's a coding issue or a lack of knowledge issue. And so it's always one of the key metrics that we recommend people put in place so that they're not surprised quarters later.
The political willingness is there. It's now the bureaucracy that has to come after it. And then when we get relatively quickly to reimbursement levels, and also for FQHCs, right, that previously were prohibited from doing telehealth in the way that we practice it now. So reimbursement was clarified, but getting the credit for the annual wellness visits and other quality metrics, that's the second, third layer of telehealth impacts that has not been fully thought through. And that's where lobbying and advocacy work from an organization like NCACH or CTEL here in Washington is paying off.
Yeah, good.
Good point. Other comments, observations?
Christian, my name is Kathy Moret, and I'm involved with school health services through the Educational Service District. And I'm very anxious to see WSU's data that they've collected, and then how the two of you can put those together. We have lots of students throughout the region that are so in need of not only telehealth, but dental health and other opportunities. So it really opens up a lot of potential health improvements for them.
It does. It's amazing what it can do for a community, especially when the patients can stay at their place of work and remotely zoom in to a telehealth visit, right, with the three-way video conversation. So getting access to care, getting dental examinations, teledentistry, those are, and telemental health as well, right? That's also very critical, especially in the high school environment or middle school environment, having access to mental health services in the comfort of the school. There's numerous opportunities to really provide excellent care to that population.
Anyone else? So we did attach this presentation to your, oh, I'm sorry, go ahead, Ramona.
Oh, sorry. I was just going to say thank you very much. It was an excellent presentation. It really got me thinking quite a bit. So appreciate it.
Great. Thank you very much, Ramona.
So the presentation was attached to the calendar invite for this meeting, so you should all have it. If you don't, please reach out to Teresa and she'll make sure you get it. And we will send out the recording for this. I would really like you to really pay attention to those last slides. You will be hearing from WSU next month. And then I guess in April, we'll come and try to pull it all together on next steps. So I'm really thinking about what we can do for our region. What are some of those regional supports, resources, whether we're providing some of the education, technical assistance, or if we're working together to create some shared services across the region. I heard something that I never thought about. You guys may have, it just was kind of a light bulb for me, is that we're really a closed unit here in North Central Washington, which allows us to really collaborate more than others around the state, because most of our patients receive care within our region. They're not going, there are some care given in Spokane and Seattle, but the majority of it is really right here. So we have the opportunity to really work together and leverage resources across systems that will continue to allow for that competitiveness, but within each organization, but then kind of leverage some of the cost it is to implement these services and then to continue them. So really look at what we can do as a region, what you're interested in, investing in? At what level would you want to invest in for our region? And then we'll tie that into WSU's and presentation and pull it all together after that. One last opportunity for questions or comments.
Thank you, Wendy. And
Great.
Christian.
Thanks, Christian. Thanks, Kathy.
Yeah.
Thank you very much. Pleasure to be with you guys.
And you all know that I have always one last thing to say. I love website manners. Can't wait to start delving into website manners.
Website minutes, yes.
Yeah, it's a good one.
Yes, I know. I checked all that. Good.
Thank
All right.
you.
Thank you very much. We'll see you next month or in a couple of months.